I was diagnosed with cancer, cervical cancer to be specific, in 2013, early 2013. I had my tests in 2012, late 2012. The reason why I actually went for this test is because my medical cover, which is one of the benefits I was getting from my job, is it was expiring. I wasn't sick, I wasn't feeling anything, but I felt I needed to utilize it. I was in a salon and I remembered, I had postponed doing my pap smear for the past 3 years. So this time I said, before this medical cover expires, let me rush to the hospital and have this checkup. So I went into a clinic and I told them, you do a thorough checkup, head to toe, anything that you can check. And they told me, they asked, have you eaten anything? I said, yes. So they told me there are several tests that we cannot be able to do when you're full. You have to come tomorrow morning when you're on an empty stomach. I asked them, so which ones can you do? Luckily, the pap smear was one of them. Sometime mid-January, I was just passing by the clinic. I thought, let me check. So I walked into the hospital. I found 3 young ladies. It was late. It was around 7 p.m. Gave out my details, and my file came, but they did not talk to me until for 30 minutes. They were talking amongst themselves in low tones. You could tell their faces had changed, and they were, they seemed uncomfortable until after 30 minutes is when I told them, are you giving me my results or not? Would you kindly give me my results? One of them is the one who gathered courage and told me, sasa tunaona ni kama uko na cancer, but hatuwezi kuambia, you need to see a doctor. I was like, what do you mean? Are you telling me I have cancer? What are you saying? And where is this doctor that I'm supposed to see? So they told me, the doctor is not here. You have to see the doctor next week because the doctor is in Nairobi. I had done it in Thika. I asked them, so what did you mean when you said that I seem like I have cancer? We can't tell you this. I just got mad. I told them, give me my results. 2 or 3 days later is when I realized, what did those girls actually tell me? I took the results, I checked, and because there were jargons to me, I went to Google. I Googled. And before you were done with Googling, you are sure that I had seen I would actually die the next minute. You get all kind of diagnosis. The things I saw scared me. And I started running up and down. I called all the doctors. Whoever was available, I ran to him. I was tensed. And he looked at me and was like, what is the problem? I told him, I'm here to do a pap smear. Then why is it an emergency? I said, you just do a pap smear. I didn't reveal the other pap smear that I had done, and it had indicated abnormal cells. It was precancerous. It was low-risk HPV, and it wasn't a cause for alarm. Now, with the information that I have now, I know it wasn't a cause for alarm, but I acted like the whole world was on fire. So the doctor did the pap smear. I did not feel comfortable. I wasn't given so much information because anyway, at that moment, the doctor would not give me any information. So I went to 5 other hospitals. So in a day, I did five pap smears. By the end of the day, I was even bleeding because this was too much. And when I got to this hospital, I wouldn't tell this other one that I'm from another one. So, and then I would ask, how long will it take? They all said 7 days. And it was the longest time. I couldn't do it for 7 days. It was so hard waiting for the 7 days. So, but one hospital, Nairobi hospital, gave me my results within, I think, 4 days. I told them it's an emergency, I need the results. Within 4 days they came, and the rest came after 7 days, and they confirmed the worst. That now it had stopped being precancerous. It had now progressed towards being cancer. To date, sometimes I ask myself, if the hospital would have called me when they saw precancerous cells, would I be saved? Would I have found myself a better place? Today, I educate people, I educate even health providers why you need to act immediately. Why you as a patient, after you do a test, why you need to go and check your results. You don't have to wait for a call. because we can be able to solve. Because if it was caught at precancerous, we maybe would have done just a simple treatment called cryotherapy, and it would have been sorted. The first doctor after the first pap smear was out, the first doctor I saw, he was an elderly man. He did not bother to explain to me what the results were saying, because you're just given HPV and numbers and CIN and CS. So there are so many things that are written there and you have no idea what they are saying. So he did not take time to explain to me exactly what was happening. And so he told me, hiyo uterus yako tutatoa. I was like, how will you take my uterus? And I don't even know where I'm sick. What is happening to me? And later he took his diary and he started writing. And he told me, you need to deposit this amount of money in the bank so that we can be able to take you to theater next week. So which day can I book you? I just looked at him and asked, are you honestly telling me to go to theater and I don't even have an idea where I'm ailing from? He did not even explain to me. It was a tough moment. You go home. I looked at my daughter and I was like, boy, I will not be there for her when she's going to high school. I'm actually going to die. But my greatest anger was with God and with the world. I was angry at God because I was wondering, God, how could you have let me of all people, go through this? I've just started this life. I'm now earning some good salary. I am comfortable. And how would you let this happen to me? I was angry at the world because they did not seem to understand anything. The world didn't seem like, you expect when you hear such news, the world will come to a standstill. That ours will stop moving, that people will stop whatever they're doing and be there for you. But that is not the case. And it builds frustrations, it builds anger, it builds confusion. Because you want attention, you don't want attention, you don't know what you want. But it's not because it's your fault, it's because you're trying to deal with something very major in your life. The doctor who eventually treated me was my 5th doctor. And he was, and he still is, the most calm and patient person I've ever met. He sat down with my brother and I and explained step by step. He took more than 30 minutes explaining to us everything. If we do this, these are the side effects. If we do this, this is what will happen. And he told us, before we even make that drastic decision of doing a hysterectomy, we need to be very sure. So there are 2 tests that we must do, colposcopy and biopsy. My doctor gave me a warning and said, we need to act very fast, because from what I'm seeing, the history that I'm seeing, the type of cancer you have is progressing very fast, because we cannot explain how December it was precancerous, now we are in February, and it is going now to stage 1. So he told me these are the form of treatments. We can either do chemotherapy, we can either do radiotherapy, laser, or hysterectomy. And now here I am, I have to think and I have to decide. It took my mom's intervention. She's the one who called me in a very calm way and explained to me that if I don't make a decision, they're going to lose me. I think I told the doctor, it's okay, we can do hysterectomy. Though not because it was less, it was like the best for me. I was still going through the same kind of pain, but I was feeling like it's the less painful treatment that I can take. So they did laparoscopy. I only have a scar this small, but inside, of course, it needed time to heal. So now I'm in physical pain and psychological pain. Why I was still in psychological pain is because I had not allowed myself to disclose to other people what I was going through. I still had not done it. So I was going through it privately, if there's such a thing. I went through it privately. I went through the pain with just my immediate family. There are all types of reasons why my friends left. But then there was a group of friends who still stood by me. They are still stuck with me to date. My daughter did not understand fully what was going on. We did not explain, we did not give the details. The previous year, we had just had my dad having a kidney transplant, and it was a moment of trauma for our family. But they stood there, they were strong. My brothers were the strongest people around me. And there is a time when, that time when I was supposed to make a decision, I remember there are times when my brothers would even call me and say nothing. And you could hear in their silence that they really would want to say something, but I don't know what to say. That they would want to help me, but I don't know how they would help me. And I think that is all that matters. Sometimes even that silence says a lot. They would come to my house and would just sit and I'm not talking. I didn't want to see anyone. I was angry. It was a mixture of so many things. So now I have done the surgery. I have to come back to my village because, of course, I needed to be taken care of. I couldn't stay with my daughter. I didn't have the energy to do that. So I left my daughter under care of my cousin and some other relatives. Went back to my village. I was with my mom, with my auntie and my dad. And for close to a month, my auntie bathed me. And I think that was the most painful thing. Watching yourself, the strong Carol that I know, young, energetic, watching your auntie bathing you. You were bleeding. You feel so useless. Actually, that's the word. You feel so useless. And then you feel so hopeless. You feel like, what is it? What is it? I remember I couldn't even laugh. And for that 1.5 months that I was bedridden, I couldn't look at myself on the mirror. I felt ugly. I felt incomplete. I felt like I'm not a complete person. I'm not a complete human being. They took away something. So that process was a time of reflection. I used to write a lot. I still have those notes that I wrote. And every time I read them, I feel like, wow, I was in deep pain. I was in anger. I was frustrated. But that journal helped me let it out. Because if I would have kept it in, I would have continued keeping it in. I know it would have blown up. Sometimes I would be in so much physical pain during the night, such that I'm just crying. The painkillers are not working. So my auntie would just come and sit next to me and say nothing, because she also doesn't know. My family, we cry a lot, so she would also cry. When we talk, we'd just cry. But I am thankful that I had that support system, because I don't know what I would have done if I didn't have them.